The common conception of pilots is that they control the yoke to control the aircraft, and that's the key part of getting us from point A to point B. However, behind that knowledge is a foundation of understanding of all the buttons and knobs in the cockpit that control all the other functions of the airplane. And the same is true for ultrasound. The more we understand the buttons and knobs, the better we're going to be able to optimize our image and make a better clinical decision. So today I'm going to give you the foundations for operating an ultrasound machine. Now, these are going to differ from machine to machine, but the basic structure is going to be about the same. And so it's just being familiar with the machine and operations and what the ultrasound can change. So my objectives today is to teach you how to start an encounter, describe the systematic process for using the ultrasound. I advocate using the same way every single time you touch it to make sure you're not missing steps. Utilize basic ultrasound functions to optimize our images, and then save and document our examination, and then end that exam so we make sure we get credit. My hope is that if you do these things, you'll be able to save your time and get better images to help in your clinical care of patients. And so there's really 5 simple steps to getting to POC success, and I'm going to run through these bit by bit. So the first step for everything is simply just getting the machine on. For the Sonocyte Edge 2, that's found in the upper right-hand corner of the machine. But for every machine, there'll just be a simple on and off button. Number 2, start the patient encounter. This is important because this is going to form the documentation aspect of that exam. So on the Sonocyte Edge 2, that's in the patient button, and when you click on that button, it's going to open up a screen where you're able to record the last name, first name, MRN of the patient, and then the reading doctor. That essentially is you. That's the person who's completing that exam, and you would just put your credentials at that point. That's how the image archival will tag you and make sure that you're documented as the person who's completing that exam. And that's really key here, to hit the done button and not the new end button. The new end button will restart that whole process over again and waste a step for you. The third step is select the right transducer. So for the Sonocyte Edge 2, that is on the bottom of the machine. You simply just click the button, and you can simply just grab the transducer you're interested in and follow it back to the machine. Now, each transducer is different. The simple way to break this up is, if you're looking for a shallow structure, you're going to want to go with the linear probe. And this is high frequency, which gives you high definition, but those sound waves don't penetrate to deeper structure. If you're looking for a deeper structure, like the heart or something in the abdomen, the curvilinear and phased array probes are going to be much better for you. Step number 4, select the right exam. This is found here. So when you hit this button, it'll pop open a menu with several different presets. These presets are specifically designed to optimize the image that we're looking at. For instance, if I'm looking at the heart, it's really dependent that we're able to watch things move over time. And so the ultrasound is programmed to optimize motion as opposed to image quality. So that exam is going to be really good for looking at the heart, but not so good at looking something very static like the right upper quadrant. Similarly, there's other presets for vascular, for muscle tissue. So just think about what you're actually looking. What is your binary clinical question, and then choose that exam. This predominantly is important because it's a time-saving exam. Historically, I've seen lots of people being unfamiliar with kind of using this ultrasound, and so what they'll do is they'll complete a cardiac exam in abdominal mode, and the image quality doesn't really suffice when that happens. So this is really key. Just make sure you select the right exam to start off with. Okay, so we turned the machine on, we started patient encounter, we selected the right transducer, we selected the right exam. Now we just need to make sure that the marker is on the correct side of the screen and correlates with the transducer. This is just important because it helps with triggering our brain and helps with conventions. And so here's the arrow here is just showing us on this transducer where that probe marker is, and that should also be on the left side of the screen when we're doing anything like abdominal imaging. Cardiac is the only thing that's different. That's going to be on the right side of the screen. So cardiac on the right side of the screen, everything else on the left side, and then make sure it lines up with your transducer, and each system is going to have a different marker, so just be familiar with whatever system you're using. And so we generally are going to either image with the transducer marker to the patient's right side or to the patient's head. And again, that transducer marker in abdominal imaging or any other imaging besides cardiac is going to be on the left side of the screen. If it's cardiac, it's going to be over here on the right side. And again, that's just by convention. All right, so we hit the 5 key steps. And now we need to know how to optimize our image. So I really like the mnemonic maggot. So that's depth, axis, gain, interpretation. And the really nice part about this for me is I think it divides things up from the sonographer or image acquisition standpoint and differentiates it from the interpretation standpoint, which is the clinician aspect. My experience is most clinicians want to get to this interpretation part of the exam really early on, and my advice here is to slow down, make sure that we optimize the depth, the orientation or the axis of the image, and the gain before we get to that interpretation. The foundation of a good image is the foundation of a good clinical decision. All right, so where do we find these? Depth, at least for the Sonosite Edge 2, is here on the left, right next to the trackpad. This trackpad really forms the foundation of what we're seeing. For the export, it would be on the right side of the screen. But again, just being familiar with the machine that you're using. Usually when I think about depth, the general rule of thumb, and there's some slight differences in this, is that the focus of your examination should be at the center of the screen. And so I always think about it in kind of the 3 bears. This is too much depth. This is just right. Okay, axis orientation. What do I mean by that? So we want our structure to be appropriately aligned on the screen. So if we think about a parasternal long axis for the heart, that would mean something like the mitral valve is roughly in the middle third of the screen. You can see your aortic valve, and your LV is not foreshortened. For the lung, it is the pleural line is horizontal on the screen. You can see your rib shadows, and you can see A lines indicating that you're appropriately perpendicular to that structure. In order to get that, we can talk about 4 cardinal motions. We talk about sliding, which is just translocating the probe in any direction. Rotating is just rotating the probe. Importantly, we can think about that being around a center axis or on a hinge or a door hinge rotation. Tilting, I prefer the word fanning here, but the image tells you what that is. So fanning is along the long axis of the transducer, and rocking is on the short axis of that. So this would bring the tail of the probe back and forth this way. A really key point, so image quality is going to be all about angle of incination. So if you are perpendicular to probe, as indicated on the right side, we're going to get a really strong reflection detected by the transducer. If you're oblique to that, not as many sound waves are going to be returning or echoing back to that transducer, and it's going to impede your image quality. And I always think about this as just looking at yourself in a mirror. The more you're right in front of yourself, the better you're going to be able to see yourself. So more reflections coming back at you. All right, so we optimized our depth. We talked about our axis or orientation. The next is gain. So on the Sonosite Edge 2, again, it's going to be over here on the left side of the probe. Again, be familiar with your machine. There's a few different things that we can talk about. The most important one is probably auto gain. This gets us probably 95% of the way, and for the most times, you don't really need to mess with your gain. However, there are some buttons that if you are looking at a structure and the gain is too bright, or that image is too bright or too dark, then you can change. So overall gain, this will change the gain of the whole screen. Far field would just take the bottom half of the screen, or the part that's away from the transducer, and change the gain selectively to that area. It's just amplifying the image essentially. If you're changing that, just the echoes that take longer to return to the probe. And then near is just the top half of the screen. And so here's kind of an instance of how gain matters. This is too bright, this is too dark, and this is just right. It's important that we want blood to be black when we're looking at vessels, so that's kind of the key for echosonographers. They'll turn up speckle, so the gain, so there's just a little bit of speckle in the heart, and then they'll make that go away. It's important because it can kind of impede our ability to differentiate structures in space if the gain is not adequate. All right, finally, let's talk about saving these exams. So let's say you have a good picture of the lung, you want to save that image. What do you hit? There's a few different buttons that can be found all kind of around the trackpad on the Sonosite Edge 2. Again, be familiar with your machine. So there's save versus clip versus freeze. So save, what that does is it saves an image exactly at the time you hit the button. Clip will essentially start a video and then will proceed forward throughout time. And that can be changed in the default settings. It can be anywhere from 3 to 6 seconds, or whatever you make your machine record at that point, or the time that you set. Freeze is a really useful function. So let's say you're imaging something, you had a really perfect image, you can actually hit the freeze button, and now you are able to scene back in time to the exact perfect image that you had. And so that gives you an ability to track back over about 6 seconds usually, to find the image that's perfect, and then you can hit save on the image that you like. The modes, these are important just depending on what question you're trying to answer. 2D is our basic B mode imaging, but there's also M mode, there's Doppler, and there's color functions that are useful depending on the examination you're completing. Importantly, if you get a lot of things on your screen and you just want to get out of it, 2D generally is like an escape button. It'll reset the ultrasound. All right, so we've optimized our image. We've started an encounter, we optimized our image, and we saved some images for uploading into archive. Now we need to end the exam. And so you hit this new end exam button, and for most of the system, that is kind of the key that'll start uploading into space, or into the archive. Real quick note on disinfection and equipment care. Generally at OHSU, the preferred cleaning solution is the Oxivir TB wipes, but just always check with local infection prevention control your local infection prevention control department if you have questions about what is fine to use. All right, so let's wrap up here. We turned the machine on. We started a patient encounter. We selected the right transducer. We made sure we are in the right exam mode for the exam we're completing. And we ensured that the probe marker was in the correct location on the screen. When we are ready to optimize our image, we did depth axis gain. So we set the depth appropriately to center our image, at least in the middle or the bottom third of the screen. We appropriately oriented our image, and we did the gain appropriately, and then we clipped the image. And so it's really key here as we think about doing this. The key is that when we're at the patient's bedside, that we do a functional exam and we don't self-destruct. And so while this may not be the most exciting topic, it is critically vital to doing a good examination. I hope with this systematic exam we've really given you a foundation to be successful.